Cancer can be treated a number of ways. The major types of treatment are surgery, radiation and chemotherapy. Every case is different, so your course of treatment will be based on your unique situation. Don't be afraid to ask questions of your medical specialists because you're a vital part of your cancer care team. In asking questions, you're helping your medical team get a better understanding of you and your cancer. And the more information your doctor has, the better outcome you can expect.
When I went to see him the next day, he said, I found some nasties, which really upset me a bit. I didn't want to hear that. I said, well, what do you mean nasties? What are we talking here, cancer? He said, yes. So, okay. So I sort of, I wouldn't say I was stunned, I was sort of half expected it. And I said, okay, well, what can we do about it?
Prognosis is a term that's used by doctors to try and predict what the likely or possible outcomes are for a particular cancer diagnosed at a particular stage. For example, doctors may use figures when talking about prognosis, and they may talk about the percentage of people who are free of disease at 5 or 10 years, or the percentage of people that are alive and well at 5 or 10 years after cancer diagnosis. Prognosis is very important to doctors when talking to patients about their treatment because the possible outcomes will determine what treatments are recommended for patients after surgery. For example, there are some cancers that have a very good prognosis, meaning a very, very high cure rate over 5 to 10 years, and these people may not need to be put through treatment such as chemotherapy because their outcome is already very, very good. Other patients whose cancers may be diagnosed at a later stage, which may have a poorer prognosis, are more likely to benefit from additional treatments such as chemotherapy and radiotherapy.
A lot of people see radiotherapy, surgery and chemotherapy as alternatives to one another in the treatment of cancer. That is not true. There is a need for surgery, there is a need for radiotherapy, and there is a need for chemotherapy, and often all three treatments are necessary in the treatment of the one condition. So they're not alternatives, but they're applied in appropriate measure depending upon the disease, the type of cancer, the site of the cancer, the stage of the cancer, and also the state of the host, the patient, him or herself. That will often determine what treatment or treatment combinations are used.
Most of the preliminaries are achieved at home or outside hospital. One comes to the hospital 2 or 3 hours prior to the operation with an empty stomach, fasting, ready for an anaesthetic, and the surgery is done on that day, so there's minimum anxiety time, if you like. How long you stay in depends on the procedure. If it's as simple as removing a lump from the breast and maybe sampling the lymph nodes, it may only be day or overnight surgery. If it's a major operation to remove the rectum or the prostate, then you're looking at being in hospital a week to 10 days as a standard procedure. As you're being taken into the theatre, the first and most tedious thing you'll be hit with is constant checking that they know which side of the body is being operated on, precisely what operation you're having done, whether everything is there with you. They'll check your name, date of birth 2 or 3 times to ensure that no mistakes are made. You'll generally be taken into the operating room awake. There was a vogue for separate anaesthetic rooms, a cubicle off the main theatre where the anaesthetic would be started, but that's unusual nowadays. An intravenous line will be set up and you'll be transferred onto the operating table, which is a relatively firm and narrow device. It's built for the surgeon's comfort, not the patient's.
Chemotherapy are drugs that are given either through the vein or as tablet form, and they're drugs that are used to kill dividing cells And in the situation that we're talking about today, they're used preferentially to kill cancer cells. So the drugs, as I said, can be given through a vein, in a cancer centre, or in tablet form taken at home.
The majority of places where you get your treatment is in a chair. It looks like a recliner chair that you would see in your own living room. And that's where most people get their treatment. There's a smaller chair sitting at the side, so you can bring someone along with you, a relative or a friend, so they can sit with you for some company. And normally it says the nurse sits down and chats to you about how you've been going, what kind of side effects you've had. And once all that's sorted out and we know exactly the treatment's going ahead, most patients have what we call a drip. Most people know as a drip put in their hand or their arm, whereby the chemotherapy gets given to them intravenously. And again, that can take a variety of time to give, from 20 minutes to quite a few hours. There can be some preparation before your chemotherapy, and one of those things is a blood test before you have your chemotherapy. And the majority of people have that on the day before. And a lot of patients ask me, is there anything else I need to do? And we say no. You can have a normal diet, you can eat before you come. There's usually no reason why you can't drive if you feel well enough. And that also goes for after chemotherapy. So after chemotherapy, if you feel all right, you can eat the diet that you normally did, you can socialise the way you normally have before, if you're feeling all right. There's no reason why life shouldn't go on as normal during your chemotherapy.
The side effect that concerns most people about chemotherapy is nausea and vomiting. And it certainly used to be a very, very common problem. The good news is that with the improvement in anti-nausea drugs, most people will not vomit with chemotherapy. You may experience some nausea, or your taste for food may change, your appetite may reduce, but you really should be able to drink and eat small amounts throughout your chemotherapy. If you're not able to do so, you really need to be contacting your chemotherapy nurses or doctor in relation to that. You will be given a strict protocol of anti-nausea drugs to take before your treatment and in the days after, and it's worth following that, and if there's any problems with it, discussing it once again with your treating team. Hair loss is very common with some types of chemotherapy drugs. A lot of the drugs that we use to treat breast cancer in particular will cause complete hair loss, usually about 3 weeks after you start your treatment. It's quite sudden, it happens quickly, and it's probably one of the most distressing aspects of your chemotherapy. Wigs can be purchased or rented through various agencies around town, and your nursing staff will be able to give you information about that. And a good wig makes a big difference to how you tolerate your chemotherapy. Other women prefer to use scarves or hats, and certainly in winter you need something because it gets very cold. Other chemotherapy types may have no impact on your hair, or there may be gradual thinning throughout the process. And so clarify with your treating team how much hair loss you may occur during that time. During your chemotherapy, you will feel tired, usually worst in the first week after chemotherapy and then improving in subsequent weeks. It used to be that people were told to rest and take it easy. But there is very good evidence now that maintaining regular exercise will reduce fatigue and improve the way you tolerate your treatment and also your disease. There's also increasing evidence that exercise can reduce the risk of some cancers coming back. And the bottom line is it'll make you feel better. Exercising regularly will improve your appetite, will help you sleep better and improve your mood. So I would stress to everybody, if you're able to do just a little bit of exercise every day, and that's just even a walk around the block or a walk around your garden, it will improve the way that you tolerate your treatment. Do all cancer treatments affect your fertility? To some degree they will, but it varies dramatically. Particular chemotherapies can have more of an impact, and therefore if you're interested in preserving your fertility and being able to have a family, it's a very important discussion to have with your doctor before you start treatment. The effects it can have are broad and varied. For some it's that it affects the way they feel about themselves, and so they feel uncomfortable with their partner and they feel uncomfortable about being intimate. For some people, it actually affects the way that they can perform sexually, and that may be, once again, that pain prevents them from being intimate, or simply that due to chemotherapy effects or to radiation effects, that they have problems with impotence or with vaginal dryness that makes sex very uncomfortable. The important thing is communication, is to discuss these issues with your partner, and often they can be resolved through good communication and intimacy rather than sexual activity. But if these issues are affecting your relationship or affecting the way you feel about yourself, it's very important to discuss them with your doctor. If you're not comfortable talking to your doctor, then it's talking to your general practitioner, your nursing staff, and they can refer you on to sexual counsellors who can help with managing the symptoms and also managing the emotional effects of chemotherapy on you and your relationship and you as a sexual individual.
Well, radiotherapy is a way of treating cancer and occasionally benign diseases with X-ray beams, and it covers a number of different forms of radiation delivery. The basic premise is that X-rays will attack the cells and stop them from dividing, and that DNA damage makes the cell dead, and then over a period of time the body will remove those dead tissues. Now, the radiation can be given generally with a linear accelerator, which is a big machine that you can see behind me. You can also give it with radioactive drinks in certain cancers, such as thyroid cancer. And you can also do it with actually implanting a radioactive source into a body cavity or into a tumour. But the majority of patients will have a radiation beam delivered to them while they lie on a bed from a distance.
The side effects of radiation therapy can be quite mild, from a very slight skin reaction or a very slight feeling of nausea, right through to quite severe and disabling side effects. I'm talking here of the immediate side effects of treatment which occur during the course of treatment and immediately afterwards. There are, of course, long-term side effects of radiation therapy which are not dependent necessarily on the acute reaction at the time of treatment, but vary from one individual to another, that some people will have quite marked late side effects and others will have practically none. Now, the side effects of radiation treatment are very dependent on a number of factors, primarily the part of the body being treated and also the dose of treatment administered. The side effects, for example, of treatment to a cancer of the head and neck region, say cancer in the mouth, might be that the patient will develop a very sore mouth by the end of a course of treatment, and the long-term effect of that treatment might be a permanently dry mouth. The salivary glands are affected by radiation therapy and may not recover, and that is quite disabling and can make life quite miserable. However, one has to weigh all side effects in a cost-benefit analysis, that what is the benefit and what is the cost, and maybe the cost being the dry mouth, the benefit being cure of that cancer.
The important thing, both from the doctor's point of view and the patient's point of view, is that we're starting on a relationship. And we want to be able to know exactly what's going on from the patient's point of view, and likewise the patient should know what's going on in our heads as well, in terms of why am I getting that many radiotherapy doses, why aren't I getting this many, and what am I going to go through. We expect it to be a frightening first day, because you're coming to some machine that you don't really know about. It sounds big and it sounds like it could be noisy or whatever. As I say, that the process is really fairly straightforward, and that most patients generally, once they've had that 5 minutes of their first treatment, will think, well, it was straightforward. But there's still always little issues that I'd like to know about and that the doctor would like to know about, in terms of how can we reassure you, how can we make sure that the procedure is as comfortable and as easy as possible.
Hormone therapy, I think, is a difficult term because, in fact, hormone therapy is really anti-hormonal therapy. There are a number of cancers, in particular breast cancer and prostate cancer, that have hormone receptors on the surface of the cell, and that cells can grow or divide in response to hormones within the body. For example, a breast cancer may be estrogen receptor positive. Most women have estrogen circulating in their blood, and the estrogen can encourage a breast cancer to grow. If we give that woman anti-estrogen therapy and lower the amount of estrogen in her body, then we can improve her outcome by using that treatment.
One of the most difficult things about having cancer is that the control over the decisions that you make in your life seems to slip away. And many people find that very hard, and I can understand that. In fact, what the doctors do is come up with the best recommendation to give you the longest life of the best quality in your situation. However, the doctors cannot make decisions for you about treatment. And sometimes a patient may decide not to have treatment. That is a valid decision, and one that we will always respect. We may not agree with it because, of course, we like our patients to live as long as possible and to feel as well as possible, but we will respect it if that is your decision. Please discuss this option with your doctor if you think this is something you want to do. The reason for asking you to do that is to make sure that you understand as well as you can what the implications of having treatment versus not having treatment will be, and how we can help you in either situation.
Clinical trials are a very important part about gaining new knowledge on how to treat cancers better. It is a partnership between patients and clinicians who are administering the new therapies. It is very complicated, and it is worth spending quite a bit of time speaking to your physician and their nurses and anyone else that may be involved in your care, including your family members, before you start or undertake a clinical trial. Clinical trials evaluate a variety of different types of treatments for cancer. They also evaluate new technologies to see if they can work out who has a good or a bad outcome from the new treatment. And treatments come in a variety of different forms. Some of them may be related to drugs, and that's the most common form that you may get approached about. But it may also include a new radiation therapy technique, a new surgical technique, or maybe even a new way to deal with stress. So does massage therapy, acupuncture, and these complementary medicines or therapies, do they help people with cancer? So clinical trials come in a variety of different forms to ask different questions. And the purpose is to work out how we can treat you better.
There can be many different impacts of dealing with the treatment, and some of those can be very physical, for instance tiredness, fatigue, finding that you don't think the way you used to think, and sometimes it can be very difficult to work out what's an effect of the treatment or what's a psychological reaction to what I'm going from, and sometimes it's not always easy to know. Certainly when we're feeling tired, painful thoughts can come and go more frequently anyway. When we're in pain, again, it can add to our distress level as well. So sometimes there will be just effects to do with the treatment, to do with the fact that what's going on is not always very pleasant. And you might not like what's going on, and you may feel angry that that you're having to put up with this discomfort and pain. Certainly always talk to your doctor about that, because there's often other things that can be done to make it less distressing physically for you. But sometimes through counselling you can talk through some of that anger that you might feel that this is happening to you, that you're having to go through this treatment process. Sometimes people can be really afraid that they're losing themselves in this process. They think differently, they feel differently. Will I still be myself after this treatment, or will I be a completely different person, not able to function in the way that I used to? Sometimes people do find there are changes in themselves through the treatment, but quite often people are surprised to find that after the treatment their energy level and their joy in the things they've always gained pleasure on do return.
Look Good Feel Better holds their workshops usually in the hospitals, sometimes in community centres, and the whole idea, people come along. Probably the main concern is hair loss. Because one minute they've got hair, the next minute it's gone. So we have wig companies come in, show them how to wear wigs. A lot of people, things like scarves, turbans. Also too, we do show them how to recreate their eyebrows, because often if their hair falls out, they can put a wig on, a scarf, but when they look in the mirror and see no eyelashes and no eyebrows, it can be a concern. So we show them how to put on eyebrows using eyeliner to look at recreating eyelashes. Also too, they can get skin changes, their skin can come dry, flaky, so we show them how to use moisturisers, the reason why they need to use a cleanser, perhaps not soap on their skin. And we talk a little bit about nail care as well. So it's quite a comprehensive, just giving them a little bit of control back into their life, yeah, absolutely.
If you get the opportunity to do it, I do recommend it, just because you're involved with people in similar circumstances. And yeah, it was good to talk to other people, you know. For me particularly, there was some people that were in more dramatic circumstances than me and were dealing with chemo and all the things that go with loss of hair and self-image and all of those things. And they came along and felt good too. So if you do have reservations, well, just give it a little while, and further down the line you might feel like talking to people about it and get involved with those programs. I mean, anything that gives you a chance to talk to people and just makes you, you know, go the next step down that road of recovery is good for people to do.
For more information about this chapter, use the resources on this page. You can pause the DVD to give you time to write down the details.